Just waiting for the little red light. There it is. Right, welcome everyone to the Scrutiny Partnerships Committee meeting today. I've got the usual legal blurb to go through first. This Scrutiny Committee meeting is being conducted on a hybrid basis in accordance with the Local Government and Elections Wales Act 2021, which will operate alongside the Council's standing orders. The Council's standing orders and code of conduct will apply at all times, and members should conduct themselves accordingly. Please, can those attending online switch off your cameras and mute your microphones when you're not speaking to ensure that there's no unnecessary background noise. Can I also remind members to ensure that if their chat function is switched on and to use that facility to indicate to me when they wish to speak on a particular item. Please do not speak until I invite you to do so, and remember to unmute your microphone and switch your camera on. A recorded version of this meeting will be uploaded for public viewing as soon as possible after the meeting. Welsh translation of the proceedings can be provided upon request, and the images and sound recording may also be used for training purposes within the council. So, welcome everyone. Just getting the right screen on my computer now, which I should have done before we started. So, item number one is apologies. I know we've had apologies today from Councillors Screen, Councillor Bright, Councillor Jones, and potentially Councillor Whitehead, who may be at work, so he may join us later. We're not sure at the moment. Have you got any other? That's all, Chair. That's all the apologies. Does anyone have any declarations of interest at this point? I thought there was a hand going up there. Right, okay. So the only
sorry, Chair, just on that, I might declare, just as to keep myself above ground, as the former cabinet member that oversaw it, because it came and reported to me under the safeguarding kind of area. So just to keep it above ground, but it shouldn't affect my ability to speak and ask questions today.
Yeah, that's great. Thanks, Councillor Marshall. I think you're right. It shouldn't affect your taking part in the meeting, but yeah, thanks for the transparency. So we're going to be looking at violence against women, domestic abuse and sexual violence. The first question I'm going to ask is, I always abbreviate that the VODA SV, but I don't know whether is that the proper way of shortening?
Yes, I'm looking at my colleagues on screen, Chair. Yes, that's right. That's how I pronounce it as well.
There we are. So we're going to be having a presentation and an explanation of the report first, because we've all received the report, and then obviously we'll go into questions. So I'm assuming, Tanya, I'll be coming to you for...
No, Chair, I'm actually going to defer to my colleague Amy Thomas on the screen, who was the author of the report. So I'm going to look to Amy to just take us through the report, if that's possible.
Right, thanks. Sorry about that, Amy. I should have come to you straight away, shouldn't I? Just before we do, I just obviously I want to welcome Councillor Druitt as the cabinet member to the meeting as well. I know I've sort of caught you on the cuff here, but I don't know whether if you've got any remarks or comments you want to make at the beginning, or should I just wait until later?
I just think this is a hugely important bit of work for the council to be doing. I just want to pay tribute to the work of the council in getting accreditation for White Ribbon, which highlights abuse against women and men as perpetrators of that. And I want to thank all the staff involved in getting that accreditation. But it's a work in progress, and there's a lot more that we can do. And so that's what today's report is about.
Totally endorse that. Thank you. Amy, over to you then.
Thanks very much, Chair, and thank you very much, Cabinet members, for having me here today. So the report that is being presented this year centres around the National Training Framework for Violence Against Women, Domestic Abuse and Sexual Violence. The National Training Framework, as a bit of background, is issued as statutory guidance under Section 15 of the Vowdys v Wales Act 2015, and that statutory guidance outlines that all local authorities, including health, should be training their workforce across what they've sort of packaged as 6 groups of training. And the national training framework is more sort of colloquially referred to as Ask and Act. So the training framework is set over 6 groups. So group 1 is e-learning, and that's basically applicable to anybody within the local authority and is supposed to be completed as part of the induction into the local authority and then refreshed on a 2-yearly basis. Group 2 then is aimed at frontline practitioners and those that are to come into contact with individuals affected or impacted by voucher, so they can ask, act and support a response to the disclosures that they're hearing or receiving. Group 3 is similar to sort of group 2, but it's at a champion level, and that's more for sort of managers of those practitioners. So again, through supervisions and so on and so forth, managers can support the frontline practitioners in those disclosures and responding appropriately. Group 4 and Group 5 of the National Training Framework is aimed at what we refer to as our specialist sector. So that would be the likes of Cyfanol Women's Aid or the Independent Domestic Violence Advocacy Service or the Independent Sexual Violence Advocacy Services, as well as Llamai, Bawzo, etc. So that's the training that goes across groups 4 and 5 is specialist, and is for those that are sort of working in that voucher field and arena every day. And then Group 6 is aimed specifically at senior leaders, cabinet members, elected members, and sort of councillors. And the Group 6 focus is basically about strengthening leadership and sort of embedding voucher within the day-to-day business of the areas that the senior leaders are responsible for. So the statutory guidance under Section 15 sort of outlines what the groups are, who the audience is, the requirements for refresher training, what that content should look like, etc. And then as a regional team, we collate the information, the monitoring, and sort of help the facilitation of the delivery of the training under the National Training Framework in Gwent.
Neil. Yeah, everybody else is okay. Amy, I don't know whether you can hear us, but you've frozen, so we're going to wait for you to come back to us.
Chair believes she's dropped from the meeting.
Oh, she's back.
Can you hear
Hello,
me
Amy.
okay?
We can now. We lost you for about 30 seconds.
Okay, apologies. Where did I get to, please?
You would,
You finished Group 5.
And 6.
yeah, you'd explained about the groups, and you were just moving on from there.
You would. Are you there,
No, we
Amy?
lost you.
I think we've lost her again. No, we've lost her.
Yeah. See if she manages to reconnect.
Sometimes if you disconnect and then
Yeah.
leave and then come back, it helps. Fingers crossed.
I'll message her as well and just try and support her from behind the scenes.
Okay, thanks, Caroline. I think that was Amy's way of just testing that we were paying attention.
I know.
When we
Where
get
did
to
we get to?
it.
Okay.
think that's a good idea. Yeah. We're just going to pause the meeting. For everybody else online at the moment, we're just going to pause the meeting just for now, and we'll try and get Amy back.
I think she is back.
And that's she's yeah. Hello, Amy. Can you hear us? You're on mute. You're on mute, Amy. No, still on mute.
Can
There
you
we
hear
are.
me now, Kay?
Yes, lovely.
Oh, I'm so sorry. I've had to join on my phone. My computer's chosen the greatest moment to crash on me.
Oh, it's always a way, isn't it?
Yeah, I'm so sorry.
Oh, don't worry. These things happen.
So I just finished on group 6, you said.
Yeah, you just started to move on from. You explained what all the groups were, and you're just moving on from there.
Okay. So yeah, so group 6. So as a regional team, we have sort of responsibility for making sure that the training is delivered across the region and including within Newport as a local authority and facilitating that delivery as well. And across those 6 groups, we also keep track of monitoring, attendance, engagement across the different departments within the local authority to look after sort of the figures then, and we then report that to Welsh Government on a quarterly basis, and we get scrutinised by Welsh Government around our sort of delivery of the national training framework. So the report that's been presented to Scrutiny this evening is a annual report from 23-24 year that covers the performance of Newport in relation to that national training framework across the 6 areas. And then in addition to the Newport performance, what is also outlined in our report is how Newport sits in relation to the other local authorities in Wales as well. So before I take questions on the report, I just wanted to add some additional context to the monitoring that goes into this report, if that's okay, Chair. So in terms of the 6 groups that I talked about, the data is collected differently across all of the groups. So there's lots of inconsistencies and there's lots of challenges for Newport as a local authority in terms of collecting that data to be able to evidence sort of uptake and meeting the statutory requirements. And even though Newport's data within the Newport within the report has sort of presented as having a good completion rate, it's because it's showed how many people have completed the training as a percentage of the workforce. But that figure is in the percentage of the workforce since 2015 when the Act was introduced. So it's not of the percentage of a workforce on any given date, if that makes sense. And there's also restrictions around the data collation as well, because we're unable to pick out who's completing the training as their initial sort of training, as well as who's completing it, versus who's completing it as part of the refresher then. But some of the things I have got information on, if Scrutiny are interested, is sort of the uptake across Newport in terms of the different departments and where we see more attendance than others, for example. And I can give you that information for the last 3 years if needed. But the main sort of purpose of the report being presented today is, despite the caveats to the data collation and the monitoring and the challenges around monitoring and reporting, there's still a lot more that Newport as a local authority needs to do in terms of training staff across those 6 group areas to be able to respond to the individuals in our community, as well as our colleagues within the workforce in relation to vouchers fee.
That's great. Thank you, Amy. I don't know whether Tanya or Caroline or Rhiannon want to add anything.
Just a little bit, if I can, Chair, just to say that since I've joined the authority in September, I've taken responsibility for chairing the Bowder SB Regional Board. So obviously haven't chaired that board previously, so learning a lot about the mechanics of the board and what is required. So I think, you know, that's positive from a Newport perspective, that I'll bring that knowledge and understanding to how we can continue to improve, you know, the areas that Amy is referring to.
Yeah. Thanks, Tanya. Caroline, I see you got your hand up.
Yes, thank you, Chair. Just really want to explain the change for Amy's team. The Bowder SB team have now moved from Children's Services and have very recently just now arrived in Prevention and Inclusion portfolio. So that is a very recent transition, and myself and Rhiannon Williams, who was also on the call, are now involved in supporting Amy, and we're very new to it, so we're still trying to learn lots and get our head around it. But we're really pleased to have this now sat in Prevention and Inclusion, largely because members may already remember we previously attended its scrutiny with our substance use partners, and so we have the regional substance use work stream that sits in Prevention and Inclusion also. So it is fabulous now that we've got both of these work streams sitting side by side in the same service area, where we want to look at how we can align, streamline and address some of the more wider overlapping issues that are absolutely happening in substance use and happening over here in Amy's world in Bowder SB. But let's try and look at how we can bring some of those issues and agendas together in a bit more of a smarter way. So we've got some real good opportunities to start working with as we go forward. I'm just wanting to explain we're not down there yet. We've literally only just received Amy into the service, so which is really welcome, but lots of opportunities going forward. Thank you, Chair.
That's great. Thanks, Caroline. I wanted to preempt the meeting. I think there's going to be some questions along those themes coming up very soon about the alignment between the different departments and the coordination between the different groups involved in this. So it's really good to hear that right from the word go. Rhiannon, I wasn't sure whether you wanted to say something then. I don't want to cut you off. Do you want to say something?
No, it's fine. Thank you, Chair.
Okie doke. We'll go straight into questions then. I know Councillor Hughes wanted to kick things off to begin with, and then we'll take it from there. So, Councillor Hughes, over to you.
Thanks, Chair. So I appreciate the report focuses, Amy, on the training side of things, and I guess it's important to just note to the beginning that this is about improving the structures and the service really, rather than any comments on staff directly. We know the staff are working incredibly hard and doing a great job, and and progressing this, and we saw that the interest was there really from the White Ribbon work that's just recently happened, and the interest from councillors especially was particularly strong, and I was really pleased about that as well. So in relation to highlighting the issues, I think Newport are doing a relatively strong job there. I think there was a common theme for us though, I think, coming through that, and I think and it's a concern to a point, is that it's that section on the lived experience of the survivors, and I think how that sort of crosses over into the actual working practices that we've got on the front line. And one of the common themes that came over strongly really was that it's incredibly hard, and I think maybe that's reflected in why it's so difficult to get statistics across the board in Newport as well, but it's incredibly hard for victims, I think, especially, and councillors in the field and anybody else sort of really, to find a central point for information and contact, especially that, we know victims of abuse especially, it's that point of picking up the phone is a key moment for them, and a very difficult moment for them, and they could be doing it in a very challenging circumstances for themselves. And I think I was looking at that a couple of times, and I was going through the search engines today, and it's incredibly hard to find anything Newport specific. A lot of it is Gwent. The first 2 pages are going to be housing associations, solicitors, and actually the strongest page really was actually, in fairness, the Gwent Police, who got a relatively strong directory. But directories are really predominantly aimed, I think, at professionals. And I think, you know, what we seem to be lacking is that central first point of contact phone number that people actually can engage with. And I think it's and that's in fairness, that's been a common theme across all conversations with counsellors and victims in Newport. I don't know if that's a problem with the IRSI sort of section of health being removed, really, I guess, wasn't it? And it hasn't. I don't think it still hasn't been replaced. I don't think, but I'm not sure if that's a factor in it. I'm not sure if it's the way. There's also one of the other things was there's a lot of acronyms in this sort of area. Even our own sort of, you know, name for it doesn't. For people that are not professional, it's very hard to know what, you know, when you're talking about even our own name, it's difficult to know. But a lot of the agencies in there using acronyms, and very few of them are actually suggestive. So, you know, you like to see things that do what they say on the tin. So if you're looking for fire, you phone 999 and you know you can get through to fire services. And it's very difficult for that. If you type in sexual or domestic violence or support, it's very difficult to get through to the right place on that. And I think we need to sort of be thinking as an organisation where we land on that one, really. So I hope that makes a little bit of sense. What else have I got? Yeah, and that's predominantly it. And I know there are good organisations like Cavano and Shamai Women's Aid and stuff on the ground as well. But I really think we're lacking that point of contact number, which everybody sort of knows and we can spread out, you know. And I think, and you know, and people, I know it's difficult as well because some of the numbers we give out, we don't want them to be that well known. But does that make sense, everybody?
Amy, so you've got your hand up to come in on that one. I was going to do this later on, but I've got an email from, I don't normally read emails out in scrutiny meetings, but I was given this message which sort of ties in with this, and maybe this sort of highlights the sort of thing that Councillor Hughes is saying. This email came to me that I was asking people to suggest or give me some idea of what things are like on the ground. And this email said, I would love to say it does exactly what it says on the tin, but unfortunately I've seen firsthand that this is not the case. This is somebody who works, I won't say which organisation, obviously. This is somebody who works with people who have suffered abuse. My question is, what can we do to make sure we're not failing these women and who are scrutinising these services? I know it sounds negative, but we really need to know we have the best support possible for our most vulnerable residents. It's hard enough to come forward without having to fight barriers. That was word for word what this lady told me. I think that links in with what Councillor Hughes is saying. So, Amy, if you want to come in there, that'd be great.
Thank you, Chair. So just on the first point in relation to what Councillor Hughes has mentioned about that sort of one contact number across the region, so Newport and the whole of Gwent, including the whole of Wales, that one contact number is the Live Fear Free helpline. So that is a free phone number and it can be accessible through email, text, web chat and call. It's available 365 days a year, 24/7. It is commissioned and funded through Welsh Government. So Welsh Women's Aid employ the advocates that man the helpline, but it's Welsh Government funded. So that is our one-stop sort of shop, really. And we do a lot of awareness raising within the regional team around Live Fear Free services. what it can offer. You know, we're really closely linked in, and we work in partnership with the helpline manager as well, Anne Williams. She's a regular in our region doing sort of lunch and learns. We recently run a lunch and learn in the region for the Live Fear Free helpline, because we do them every quarter, and the one that was attended last quarter had not far off 160 people on the call. So Anne could sort of explain what the helpline was for and about. The reason why, it's not just because obviously Welsh Government fund the helpline, but the reason why we signpost and give the details for the helpline is because with directories, what we've found, Councillor Hughes, over the last few years is that lots of organisations have had their own directories on their website. So Gwent Police have one, Cabanol have one, Llamai, etc. We haven't had one in the regional team for a while, but because the services are changing on such a regular basis because of their funding requirements and everything, it takes a lot of manpower to keep on top of. So it's quite difficult then, because obviously we don't want to risk giving out information or somebody finding information that they can't, it is of no use to them, and then sort of puts them in more danger or doesn't give them the opportunity to make that call for their own sort of safety. So the Live Fear Free number is the number, and we've got lots of merchandise. We are a very small team, there's only 4 of us, so we haven't got a comms worker. We rely on comms teams within other organisations to sort of help us promote that. But that is the sort of the one-stop shop then, and there's somebody in Live Fear Free who has this responsibility of keeping those services up to date on a daily basis. So when people are ringing, so it doesn't have to be victims, professionals can ring that helpline as well for support with anybody they're working with. When they ring that helpline, it's been updated that morning as to whether the project they're about to talk about or refer to is still in existence, or if it's full, if there's a waiting list. It's the same with refuge as well. They've got access to all the refuge spaces in terms of whether there's beds available or not. So the Live Fear Free is sort of like the main point of contact. Coming to your point then, Chair, around scrutinising the services, I absolutely acknowledge and understand the author of that email to you and the position that they're in. Unfortunately, we find in the regional team that because our role is to sort of ensure that the local authority and health are implementing their duties and their responsibilities under the Act, and again, we are a really small team, there's only so much we can do in terms of scrutinising services. Through the Vouchers Fee Board, I do provide advice and guidance to the board in terms of where services are falling down, or even where there's elements of best practice that we can grow and sort of look to spread in terms of commissioning and outcomes. But there's lots of challenges because we've got challenging governance arrangements in the region. In addition, there is a heavy reliance on the specialist sector to deliver the majority of these services, and their funding is very sort of fragmented and piecemeal, and is almost operated on, if it's not operated on an annual basis, the funding is done on a sort of maximum of a 3-yearly basis, which has a real impact on the sustainability of services. So no sooner our specialist sector sort of able to draw down that funding and start meeting that need, that they're already planning then how are they going to sort of sustain that after the exit date or the end date for the current funding. And the funding landscape across Vouchers Fee is so complex and convoluted, and Welsh Government acknowledge this as well, and this is what's being discussed in the Welsh Government Vouchers Fee National Blueprint work stream, that it's really not supportive of Objective 6 of the national or the regional Vouchers Fee strategy in relation to that needs-led, strengths-based, high-quality support for victims. So I would love to be able to say that we could go into a service and we could do a deep dive and, you know, scrutinize and offer loads of solutions. But the reality is we can do that, but there's, because of the funding, because of the governance challenges, that's not unique to us in Gwent. Unfortunately, because we've got some areas that are not devolved as well, like Home Office, Ministry of Justice comes into some of our legislation and our funding as well. It's a real difficult one to unpick. But yeah, you know, we're trying our very best in terms of trying to get services that are needed within the region, and sort of making sure that they're responsive and they're of high quality as well.
Yeah, thanks, Amy. I totally understand what you're saying about the funding issue. So, funny enough, I was on a meeting yesterday, a separate meeting, but discussing funding again, and it's the same story as so many different areas where so many funding streams are short term, whereas you're trying to put in long-term solutions where you may not get the results for maybe a couple of years, but you have to provide evidence maybe 6 months down the line that that funding needs to continue, and it's really frustrating. I do get that. Can I just, before I go back to you, Councillor Hughes, can I just quickly ask you, Amy, about the number you mentioned? So I don't want to put words in Councillor Hughes' mouth, but certainly from my point of view, it's not so much having the one number that's the problem, it's the visibility of it. If somebody is suffering domestic abuse and they're in that really stressful, potentially dangerous situation, and they've got very limited time to find the number, if they say for example, they go into Google and type domestic abuse Newport, is that the number that pops up on the screen? Is it visible and there, or is that what needs to improve? Because the number may well be there, but how easy is it for them to find it?
So there's two points on that, Chair, if I may. The first is I've noticed recently that when I've typed it in, to actually get the number and the details and use a link myself for people in health, I've noticed that the search results has gone down, the Google search results. I've raised this with Welsh Government and they're looking into it so they can make sure that when it is searched, it does go back to the top of the Google search, because I noticed that in the last fortnight. Secondly, there's always going to be more that can be done in relation to the visibility of that number. Is something that I feel like sometimes we're a bit of a broken record on in the regional team, because it's something we're constantly pushing out. But again, there's only 4 of us. So if there is something that Newport comms team can do in terms of not just internally putting it on the internet for staff, but making it available on their website, their externally facing website, then I'd be more than happy for that to happen, because I think that it just offers another route. For the most part, though, the Live Fear Free campaigns and the promotion of it sits with Welsh Government, and they do a number of, every so often, they do a number of TV campaigns, or they do sort of radio campaigns. So I can push for Welsh Government to sort of put a date on their next one, and we can, from a Newport comms team, we can look to piggyback off that and push it across the local authority as well. But in relation to the number, it is a free phone number. I would like to say it's fairly easy to remember. It's probably because I refer to it at least 3 times a week in my role. But for those victims that do need it in a time of crisis, or even if they decide to look at it but not use it there and then, but at a different time when it suits them, we do have a number of merchandise available with the number subtly on. So I can't show you now because it's on the back of my laptop, but we've got barcodes that is literally just a barcode, and the Live Fear Free number is disguised underneath. We've also got lip balms with a barcode on. We've got sort of anti-bac as well for your hands and things. So we have options available to share the number subtly and sort of discreetly with victims and survivors, so they don't have to fumble around doing a Google search or look for it if they find themselves in that position. And all of that merchandise is available in the Civic. It's kept in a storage room in the Civic, so we can get that sort of in more public places. if helpful. I know we've recently sent a batch out to GP surgeries, but again, if it's requested, we can arrange for it to be delivered somewhere for it to be handed out to the public.
Okay, thanks, Amy. That's great. Caroline, you got your hand up?
Thank you, Chair. Really, just to come in on the back of what Amy was just talking about and around that visibility of that number, I absolutely agree with the points that have been raised so far. I think we do have opportunities here in Newport going forward in terms of what we can start to do a little bit more robustly. So within prevention and inclusion, we do our regular events. We're always holding events in the riverfront or in community centres or within schools. I think there's lots of opportunities here that we can link in with Amy's team. Fully appreciate Amy's team has only got 4 people, so it's not that we can have them out at all of these events, but certainly there's a whole team that sits behind within prevention and inclusion. So there's opportunities there where we can bring that visibility, bring that merchandise out into those events so that it's actually out in those communities. We also have 2, potentially 3 new assets coming into prevention and inclusion, again right in the heart of communities where we want residents coming in now and accessing support as and when they need it. There are going to be other opportunities there where we can actively promote the visibility of this merchandise and that number. So, you know, it's not perfect, but there's certainly things that we can do to improve on. And I think sitting in prevention and inclusion, I think we've got some really good opportunities to improve on that. Thank you.
Thanks, Caroline. Thanks for your patience, Councillor Hughes. Back to you.
Yeah, I think it's something we need to push back, Amy, on you know, either from your side and our side, I think politically as well, because I think, you know, I've just gone through the Live Fear Free now, and I've gone through 100 pages and can't find the number if you type in the, you know, domestic violence. So I think, you know, firstly, what the Welsh Assembly should be looking for, if that is the number that we're pushing, then that needs to be really at the top of that, the pile really, and it needs to be very clear on top of that. And I even think the Live Fear Free means a lot of things to different people, you know, and I think, you know, it needs to be much more expressive about what it actually does and who it's for, as a strapline above that, maybe, you know, on sort of certainly on search engines. I think that's the first. And I think underneath that, you're in a situation where, yeah, so you know, I'm still looking, but then I just arrived now at 2 of the organisations I'd be looking at as a professional first, if I was looking at this issue. And so you've got one now that's actually saying you can contact the Live Fear Free helpline by text 24/7 on, and it's a different number. And I think, you know, that just shows you, for me, how absolutely chaotic some of the link-ups between organisations and understanding that number is. So I've got 2 organisations here now that are putting out a completely different number to the one that we're trying to headline, and these are the biggest agencies working with women in that field. So for me, there's an absolute mismatch there between what the Welsh Assembly are trying to do and say. And I think, you know, the very fact, and it's not a reflection, I'm totally taken on board what you're saying, there's 3-4 of your staff there. It's not for you to be doing that. This is a Welsh Assembly and a much bigger issue for people to grasp and get their hands on. But if they're serious about actually supporting people going through domestic violence, I think they really need to get a handle on this one and do it as quick as they possibly can, because at the moment the resources aren't there, and the like I said, the mismatch just doesn't make sense really. So I think we need to get on top of that, and whoever's job it is, whether it's us as local politicians or the agencies working in that field, they need to sort of really understand the nature of the problem, which is it's very difficult to get support and that first line of contact, and secondly, get their act together in relation to you know, being committed to it. I think on that level, because it's great for us to write report after report and training after training, but at the end of the day, it's got to work for the victims on the ground, and that's the most important part really. And it's not, I don't think, so that we really need to get a handle on it really, if that makes sense.
Thank you, Councillor Hughes. Councillor Jewett.
Yeah, I was sent the contact numbers the other day, and I'm putting together 4 councillors, as you may be aware, and list of emergency contacts. So these will come from councillors. making the emergency number visible out in the community. And I think QR codes can do that quite effectively. Councillor Hughes made a good point about maybe looking on the search engine of Newport City Council website, which is being updated, and it's not really doing good searches at the moment. So I suspect Councillor Hughes is correct in suggesting that if you do a search for domestic violence there, you're not going to come up with a phone number. But these things are
they're work in progress.
yes, they can be got over and improved and part of the ongoing process.
Thanks very much. Does anybody else got any other sort of related questions on this before we move on? I can't see any hands up at the moment, but nope. Okay. I think Councillor Marshall, you had some questions you wanted to ask regarding training, I think.
Yes, thank you very much, Chair. So the first question, basically, how does the council ensure that its training aligns with the priorities of the multi-agency partnerships to avoid duplication and ensure cohesive responses?
Who wants to pick that one up? Amy?
Yeah, I'm happy to pick that up, Chair, if that's okay. So across the different groups, Councillor Marshall, we have dedicated points of contact within the local authority. So they're not sort of overwhelmed then in sort of making sure that they're meeting all the group's sort of requirements. But they do have just that one group that they're looking after. And then with that point of contact, they are supported by the training coordinator who sits in my team. So the training coordinator is funded by Welsh Government and has responsibility for implementing and making sure that the relevant authorities are able to deliver the national training framework. So alongside that, the point of contact and the training coordinator, they can plan, plot and sort of scope if there's any barriers or challenges and look to resolve them. And the training coordinator will also share, because the training coordinator supports the other local authorities as well. If there's similar sort of barriers or challenges, then they can look to take a regional approach to support the whole of the region in increasing their attendance and completion of the training. Or if it's an individual local authority that's having the challenge or the barrier, then they can work through that accordingly. So there's those dedicated points and resources. But in addition to that, we've also got, we call it a training subgroup within our governance structures. So there's that constant sort of feeding in of the monitoring and the recording and everything. And then that also links in with, for example, the safeguarding. So Welsh Government have released their safeguarding standards recently. So we link in with the safeguarding standards as well to make sure it's not the training being implemented is focused on vouchers fee, but it's also holistic within that wider package of safeguarding as well. Does that answer your question?
That's great. Thank you very much there. It kind of links on to one or two other areas on this as well. And I think from reading the report, basically there seems to be barriers in potential recruiting and retaining trainers for Ask and Act, seeing various training sessions cancelled. I know there has been other sessions cancelled because of lack of numbers. So just really want to hear about the trainers and about how many trainers Newport has. But what are we trying to do in order to break down the barriers to ensure that we have the staff to be trained, but also have the actual trainers behind that?
Okay, so in relation to that, Councillor Marshall, as a sort of quick point, Newport has 2 trainers that are trained to deliver Group 2 and Group 3 Ask and Act, and one of those is currently on maternity leave. The training, so to become a trainer, you have to go through quite a rigorous train the trainer programme that is run by Welsh Women's Aid, again, commissioned by Welsh Government. And then it's not just a case of doing the training, it's actually doing the training programme, but then what follows is a booklet that you've got to complete and sort of further shadowing and things of training before you can be considered a trainer. So there's all that to go through as the trainer. So the natural challenge there is capacity within the workforce to be released for all of those different elements to become the trainer, as well as then the capacity to be able to be taken away from the day job to be able to deliver the training itself. The model that we've got in the region for training, and this is the model that's prescribed by Welsh Government, is that we fund a specialist sector provider to deliver the training, and then a relevant authority, so local authority or health, co-deliver that training. So in Gwent, we use Llamau and Story as our specialist sector training providers. But one of the challenges we have is because we haven't got that many trainers in Newport, and then even though we've gone through a period recently of trying to recruit trainers, we were quite successful in that we sort of identified 7 potential people who could be trainers. They've gone through the training, but I think because of the demands that come after it, they've realised that they haven't got the capacity to do it alongside their workload. And now we've seen those 7 drop down to 2. So there's that challenge around all of this ask is in addition to everybody's day job, which isn't sort of sustainable again. But then also where the knock-on effect of that is where we haven't got people within Newport or any other local authority that can support the trainers, because the training has to be delivered by 2 people. We then have to pay the specialist sector to bring in a co-trainer, which depletes the ring-fence budget we have for the national training framework, which means the more we have to pay the specialist sector to co-train, the less training sessions we can actually deliver then over the space of a year. So the training coordinator has a meeting with all Gwent workforce development leads next week, and they are exploring sort of different innovative and creative ways to come up with how they can grow that pool of co-trainers and sustain that pool of co-trainers. But the struggle is that we're relying on workforce development colleagues to identify people within the local authority, and then even if those people are identified and they're considered suitable, it's then whether they can balance that within their day-to-day role. And I don't know, other than, you know, somebody being given a directive that they have to do this co-trainer as part of their additionally to their role, I don't know. We're sort of struggling in terms of what the answers are to trying to continue to grow and sustain that pool all the time.
Thank you for that. And I think that it is slightly concerning on that side, obviously, if Newport has 1 because of the maternity leave side of things then coming in. I wonder if maybe I could pose that to the cabinet member, if he would give a response maybe on that. I know obviously it might be news to him as well, but just hopefully something that we can take forward collectively to make sure that's a high priority, because that's something I think that we do need to address. Is that okay, Chair, if the cabinet member wishes to come in?
The cabinet member, are you happy to?
Yeah, I think that training on this, education, which is effectively training, is so important. If staffing of the trainers is an issue, then that needs to be addressed.
Tanya, you want to come in?
Yes, please, Chair. And I think it absolutely is an issue, but I think the fundamental problem here is the model that is being relied on to deliver this training, because we are asking very busy frontline practitioners to do this alongside their day job. It's an add-on. And I think for me, that is the fundamental issue with the model. and the lack of resourcing connected to that.
I do totally understand that. I mean, I remember a few years ago, before I became a councillor, I worked for Communities First, but I also did the education program for patients. I was a trainer for that, and it was exactly the same thing, doing it over and above your job. And in the end, the two things just didn't work, because it's finding that time to do that extra role. So yeah, I understand what you're saying. And same with Amy as well. I know you brought that point up, that people are doing this over and above their normal job, and it's not sustainable in the long term. So you that model needs to be looked at. A really good point. Caroline, you've got your hand up before I go back to Councillor Marshall.
Yes, thank you, Chair. Really, just to add to Tanya's point, actually, because that was what I was thinking along the lines of people's busy workload capacity. But there's also the element of training itself. Training itself is a particular skill, and it doesn't appeal to everybody. So, you know, people have got job descriptions, and that does not involve delivering training very often. So it's a big ask, and we rely on goodwill and for those who are particularly interested in delivering training or becoming more involved in this particular area of work. So yeah, just add those particular issues on top of Tanya's point, you know, they add to the challenges that we face. Thank you.
Yeah, thanks, Caroline. Councillor Marshall.
Yeah, thank you. I think it's just the point for the cabinet member. I know he's of deep interest within this area, and it just hopefully, if we can review this and maybe see whether or not there could be ways of looking at whether or not we have a directive member of staff or things moving forward, or those questions which I'm sure he'll have in his briefings moving forward, just the kind of thing that's saying, you know, that is a concern for us, and hopefully that he'll take that on board in order to try and get hopefully resolves as we move forward, to make sure that we can move forward collectively on that particular point. And it comes on to the
Marshall, sorry to interrupt, but see the cabinet members nodding away, and obviously we'll make a note of that.
I could see that too.
Summary. It'll be our summary.
No, that's fine. I can see that, and I am reassured. Thank you, and I could see that, and I was reassured of that as well. Thank you. It comes under the next point about that budget side of things, then sufficiency, and just whether or not we do have current funding that's sufficient to meet the training targets and needs, and what steps are being taken to both secure additional resources or streamline costs, especially when we're looking at like commission services.
Amy, you'll get to pick that one up?
Yeah, I'm happy to pick that one up, Chair. So in relation to the budget, Councillor, we get a number of budgets from Welsh Government for vouchers fee, but the National Training Framework is a ring-fence budget. It is a regional budget as well, so it has to go sort of far and wide. There's flaws in that it's not sufficient. It's been a static budget for the last 4 years, and it's not sufficient to train the required number of practitioners across the region, particularly in relation to groups 2 and 3 generally. So when you consider why Welsh Government prescribe the model of training that they do in terms of the specialist sector, and obviously the relevant authority being the co-trainer, so that budget can stretch a lot further. But fundamentally, that budget is not sufficient to start with to be able to train staff across the region. Is something that is on our vouchers fee board risk and issue register, and it's a conversation that myself and the other regional advisors in Wales have with Welsh Government at least 3 times a year, as part of our sort of regular meetings with them around budget, where we try and influence for more money and things. But it is not, I think I found out the other day that Welsh Government only have 8 million or around £8 million in the whole vouchers fee budget for the whole of Wales. So when you think that that's got to be split up across the regions, and then also that's got to cover training and it's got to cover staffing costs and things, it doesn't go very far essentially. So other than continuing to lobby Welsh Government through our Vouwders V board, risk and issue register, and through the National Blueprint work, there's not much more, I believe, that we can do to sort of leverage or secure more funding.
Thank you. And to piggyback off that, so you said about the budget's been static for 4 years, which obviously has its own individual inflationary costs, obviously within the last kind of 18 months that we know of in relation to costs. I just wanted to ask on that piggyback about how does that affect the strategy between 23-27, because we're obviously coming up towards that latter half, and obviously, how do we see ourselves, will we complete it, or is that something that we'll try and aspire to later? And the other one is about just what is the Welsh Government feedback like? Because obviously they're asking expectations of us as local authorities to do specific functions in relation to this. But how are they receiving feedback to say, actually, we've been challenged by this resource, we've been challenged by funding. What's their feedback in relation to our challenge back, if you will?
So on your first point in relation to the strategy, I think because we're only, so the strategy was 2023 to 27, but we only started the sort of first delivery the first delivery year of the strategy on the 1st of April this year. So I think it's probably too early to call at this point, because it's only been up and running sort of, we'll say, 8 months now. To the position as to whether we'll be able to achieve it or not. Obviously, myself and my team, we invest a lot of time within the governance structure across the subgroups and supporting partners in working towards that strategy. So our aspirations remain the same, and we're very ambitious in terms of the achievement of the strategy. In relation to the Welsh Government feedback, as a regional advisor, alongside the other regional advisors in Wales, we have, speaking for myself, we have a good working relationship with Welsh Government. They are very approachable in terms of challenges and barriers, and they're very receptive to listening to us as well. I have seen in the last year in particular that a lot of the issues that I, and as well as the other regional advisors, are raising are feeding into the National Blueprint work. And we also, within Gwent, we have the benefit of having a really good relationship with the national advisors as well. So these issues are raised regularly with the national advisors, who obviously meet directly with Cabinet Secretary on these issues. So they are very receptive, and there's a lot of sort of understanding and acknowledgement of the challenges that are faced. I'm not sure whether the money is there, given that they've got such a small budget, to be able to change what needs to be changed, really. But we remain hopeful in that, since the new Labour Party have come into government, and obviously they've made a commitment to have VAWG as part of their manifesto, that we have heard that Welsh Government Vouwders V policy colleagues are meeting regularly with Labour colleagues in central government and sort of the Home Office and Ministry of Justice, and having those conversations. So I feel positive and reassured about that.
Thank you very much for that. And I think it's probably, as you said, from April, so it's an early kind of stages yet, but hopefully they'll be able to catch up through that. And as you said, with changes of government on UK level, new policies, come new resources, new funding. Hopefully that will come down through the devolved. And it's just about that expectation, if you will, and both shared aspirations that we have collectively, and about what we're doing to manage that expectation as we're working together to basically make lives better for residents. So I do appreciate of that response. Thank you for that. My next question is just basically about intersectionality within training as well, and about how training is being tailored to address the unique needs of like marginalized groups, which includes LGBTQ plus individuals, ethnic minority individuals, and older victims as well, please.
So in relation to our training, so under the national training framework, the content for groups 2 and 3, so group 1 is overseen by, the content for that is overseen by Welsh Government. So we don't really have a say in sort of how that's updated, but particularly in relation to group 2, group 3 and group 6, the training coordinator in the team will work with the specialist sector on an annual basis. It happened actually now in the spring, on that review to make sure that we are feeding in and we're keeping sort of relevant in terms of intersectionality. Just for councillors' understanding, and a bit of context, we've recently done some work on male victims within Gwent, so we can try and look to see what the need is there or what the barriers or the gaps are to male victims seeking support, and we're looking to use that to feed into the training as well. And LGBTQ plus is a bit of a tough one for us because there's minimal sort of data collection or the data sets then for collecting that information don't really exist across partners and things. So, and where they do exist, the data is very patchy. So what we're looking to do, again, a piece of work we're looking at in the regional team is working with regional leads and police colleagues and probation colleagues to see how we can influence sort of data systems then, or data sets, to make sure that we can start collecting that information on LGBTQ+. We collected in MARAC, for example, the multi-agency, sorry, my mind's gone back now. I can't think what MARAC stands for, but the MARAC conferences, we collect LGBTQ+ information there, but we are looking to see at how we can influence to collect in other places to be able to feed that intersectionality in. And then the same for ethnic minority figures and data as well, because ethnicity is often, we've done a needs assessment recently, and one of the things that come out of that is in relation to ethnicity, partner data is often on the basis of an assumption rather than a specific direct ask on a person's ethnicity. So again, whilst we have that data, there's sort of caveats around its interpretation or use of it. But in relation to older people, we've done a significant amount of work on older persons recently, mainly because within Gwent, we've had a lot of domestic homicides that are older people. So again, just for sort of councillors' context, the average age for domestic homicide in Gwent is 61. And a lot of the reviews that we've been doing have identified sort of similar common themes. So we've not only reviewed the national training framework to update and include on older persons, but we're also looking to feed that information and that learning into our, what we call our specialist syllabus. So our specialist syllabus of training is just some sort of training we commission based specifically on regional needs to respond to those. And the other thing we've done since the recent domestic homicides in the region, we've done a real push on older persons' needs. So for National Safeguarding Week, we did some presentations in National Safeguarding Week around older people and multiple and co-occurring needs, and why older people can sometimes be hidden. I've also delivered training to health recently, and it features sort of older people as case studies there, because older people tend to stay away from vouchers fee services, but they do tend to go to GPs and access GP services. So we've targeted sort of GP training there. And in January, we've also put together a 2-hour sort of it's going to be like in a webinar format on the learning from the recent older persons domestic homicide reviews that we've had, which collates all the themes in relation to older people, and then sort of encourages professionals and practitioners to have that professional curiosity and look specifically at their needs. So obviously we can work on a preventative approach as well.
Thank you for that, Amy. And with that question, it's obviously positive to hear there's a lot of work being done. And although early stages again about the systems in play and things like that there, and I think it's important, when we're looking at projects like you probably do yourself, look at SMART, the second letter being M for measurable. How do we measure it? And noticing that there is a challenge in how we measure, but also about looking at the fact that we've addressed that issue and then looking about how we are, looking to resolve that issue. And that's important to do so, because how do we know the work has been effective unless we have that data? So I know that that's imperative as we move forward. And just ask, if there's any challenges in that regard, that please do add it in, and any positive feedback or any challenges as well in the next report, when we see you probably in 12 months time or so, that would be good with those items. I think as well with the specialist groups, I think it's also about the kind of specialist kind of modules, if you will, or areas of discussion that's important. And I think includes critical topics like the honour-based violence sometimes. The when talk about child abuse, male victims, as we said there, and people attending some of that training. From what I understand, the numbers can be fairly modest. And is there gaps within looking at that training, or is it again goes back to is it a trainer question, or what's the situation like in regulations to those? And forgive me, I can't remember the one about female mutilation, the thing of it, but you understand what I'm referring to on that. How are we in relation to addressing those as well in that regard, please?
So in relation to the specialist training, again, we have a very small budget for the training every year. So we have to try and make it stretch as far as we can. But the training coordinator in the team will look at the themes coming out of the region, and that could be as a result of domestic homicides, or it could be where the specialist sector or colleagues or social services are getting in touch and they're saying, I'm experiencing this scenario, this issue with this family. Is there any training that I can go on to support my understanding and skills and things? So we have a core offer within that specialist syllabus every year, and that core offer is domestic abuse, coercive control and MARAC. So everybody's aware of sort of signs, how to spot, complete the domestic abuse, stalking, harassment risk assessment form, the DASH, and then make that referral to MARAC to support high risk victims. Honour-based abuse, female genital mutilation and forced marriage also forms a core part of that syllabus as well. And usually, and I say usually because it's currently under review in terms of the content, is understanding perpetrators, or sort of understanding those who harm as well. So that forms part of our core offer. But then every year, what the training coordinator does is she goes out, she speaks to lots of different people. She takes the feedback from the evaluations that come through from the training that we're currently running, whether that's the national training framework training or whether it's the specialist training that we're delivering. And she will do a full desktop audit of what the themes are, that feedback that's coming through, and then she will look to go out, speak to practitioners, do little focus groups around, gathering more information, and then look to put together an offer based on all that feedback and that engagement work that she's done. And then what she'll do from there is she'll send her findings back out to the region. So she's contacted me this morning because she's got a survey together which covers off all the themes, and she's going to send that now through our VODISV fortnightly bulletin, which has excess of, I think, about 700 recipients. and she will ask all of the people in the fortnightly bulletin to rank what they feel are the training needs, and then we assess from there whether we can afford to deliver training on all of those needs, or if we have to prioritize. We've got an understanding then as to what we need to prioritize for professionals across the region, and then obviously we use the budget accordingly to plan and plot that for ready for the 1st of April.
Thank you very much. And just a point of clarity, I suppose, on that. With training and that, and saying about the budgets, has there been any coordination for kind of sharing training? Does it have to be in person because of the nature of the discussion and welfare, or can it be done online to signify that there could be shared budgetary training, especially if there's a small number of people by across Wales? What's the scope, just so we kind of understand what that training involves?
So in terms of our specialist syllabus training, we've got a mix. So most of our training takes place on Teams, but we do have some training that we deliver in person, and that's just for sort of trigger, staff well-being, so we can check in on that basis. Our training is, we normally allocate spaces for 20 to 25 people, and I would say 90% of the time we sell out. It is free training. We advertise it through Ticket Tailor, but we do sell out of that training. We have in the past had to operate waiting lists as well. So it's very rare, because the training coordinators become quite sort of savvy now in relation to avoiding Mondays and Fridays, because they're not particularly good dates for people, school holidays, around Christmas. Winter, like next sort of January to March, is absolutely no good for health colleagues because it's winter pressures. So because she's become quite savvy at where to plot, we very rarely now have to cancel training. So in relation to the shared space, we've got our own training in Gwent, but we can tap into training that Welsh Government have commissioned or are commissioning. But that only tends to happen around sort of the group 4, group 5 that I mentioned earlier under the national training framework.
That's great. Thank you very much there. So I just noticed I actually had a duplicate question, which I'll get rid of as well. The next point, if Chair will allow, is about survivor engagement and accountability as well. I know from the strategy, it was heavily related in relation to hearing that survivor voice, as we should, in terms of the issues that they've experienced, because that real life situation actually hones in a little bit more than, this is the figures on a piece of paper. It really does showcase, what someone's been through, and about at what point, did interventions occur and things like that, what support they've been given, to see how as individuals we can make a difference into that situation, and at what speed. So it's just basically about how that's in itself incorporated within the training programs, and how does the local authority ensure that their input leads to a meaningful systematic changes, but also looking at the just basically about how it's linked in with that training, to make sure that we don't lose that survivor voice, and that, because I don't think, from what I was reading from the strategy, about how it's actually implemented within the training core modules and other in itself. So just a bit of clarity more so in that question.
Of course. So in relation to survivor engagement specifically for training, the specialist sector have within their own organisations sort of they referred to as different things, but they have groups of victims or survivors, so they can be referred to as victim reference groups, survivor groups, focus groups, etc. So because we don't actually, we support the development of the content, but we pay the specialist sector to develop that content based on their expertise, their knowledge, and because they've got access to those survivor groups. So even though we will link in with those survivor groups, primarily that engagement is done between the specialist sector and the training provider in the specialist sector and the victim survivor group that specialist sector has, if that makes sense. So it's all done within house as part of that development and that content, and then our training coordinator will come in and they'll go through it and they'll review it, and then they'll sort of look to see if the outcomes, and then it could be that it goes back to the survivor group and there's sort of more improvement or work developed on it. But then also the evaluations that come through as well, they can be shared with survivors to support that updating or that review of content. I'm not sure that it happens as a sort of given or on a regular basis, but there is that mechanism as well, because one of the things that we are really, really sort of conscious of is that when we are delivering training to professionals, frontline practitioners, we need to make sure that the lived experience and the voice comes through. So when you're sat in that training as a professional or practitioner, you may be able to relate it and think, oh, that's Joe Bloggs who I seen last week, or so it's more applicable in terms of that learning, and it maximizes the impact of that learning then.
Thank you very much there. And I think it's just important to reflect as well is on about ACEs and adverse childhood experiences. And I know obviously that's seen as differently because it used to be a collective. And I know now that there's a lot more kind of approach of looking at the individual child in those situations that are deemed as a separate, I'm not going to say separate unit, but you understand what I refer in that regard, and about how, when interventions happen and things like that, about how, each of those, both the woman or whoever it is supported along with the child supported in their own right, because things like that can have obviously an offsetting kind of outlook of how they may go on in life, and what may happen to them, and opportunities and experiences as they move forward. So no, I do appreciate that answer and appreciate on that side. And I think it kind of brings us on to accountability for us, essentially, and organisations. And just want to know about the challenges and mechanisms which are in place to hold accountable for meeting the statutory training requirements. And that's for all organisations. Are we all doing what we should be, and how are we held to account for not doing so?
So I think coming back to the points of contact I mentioned earlier. So in terms of us as a regional team facilitating and enabling relevant authorities to sort of implement their duties and their obligations under the Vouchers Fee Act, we have our points of contact and we provide as much support as needed or as possible to those points of contact. But I think that beyond that, obviously, we haven't got any control or influence as to how that's then taken down and disseminated or shared throughout the relevant departments or directorates. I know that the people that we link in with in terms of our subgroups and our governance arrangements are aware of the statutory responsibilities, but like I said, beyond that, I'm not sure how that's shared. But on there is work going on at the moment around making senior leaders more aware of those statutory obligations. So it's not just going to the point of contact that we have and then possibly stopping there or just being shared among, within that team. Is actually senior leaders are aware as well, so they can delegate down if needed, as well as obviously take ownership. So since Tanya has come on board as chair of the Vouchers Fee Board, a letter has gone to the chief executive around those statutory responsibilities and sort of like having a refresh then and making sure that we're covering those responsibilities and those obligations, awareness and implementation across all levels of the local authority, rather than just sort of relying on those who attend the subgroups then. I don't know if Tanya has anything to add to that.
Oh, yeah, sorry. I'll just bring Tanya in then.
Thank you, Chair. Yeah, I do. And this is quite Newport specific, which obviously you'd be very interested in. So as a local authority, we're standing up a new corporate safeguarding board, which I will be chairing. The heads of service from every directorate within the council will be sitting on that board, and compliance with Founder SB training and general safeguarding training will be on the agenda of that new board, and we will be monitoring the uptake of the training across the council, across all directorates. So I think, you know, I hope that sort of provides members with some assurance about the level of monitoring around this that will be occurring within Newport going forward.
That's really good to hear, actually. Thanks, Tanya. Councillor Marshall, do you want to come back in?
Thank you. And it comes on to that leadership and engagement as well. So basically talking about officers, but also us as councillors, the political leads. So that's cabinet and elected members, which I know was briefly kind of noted earlier. It just feels that from the report, there was no Group 6 training undertaken for senior leaders, and just wants to know basically about how does the council ensure that leadership is fully equipped to understand and, you know, kind of make sure that we're aware of what we are expected to do under, you know, both the strategy and the Act, and just basically to make sure that how are we equipped in order to champion this particular policy area as well. Yeah, thank you.
Okay, thanks, Councillor Marshall. I'll bring Tanya in straight away, and then I'll give you Amy. That's all right.
Yeah, just to say that, you know, that is something that I picked up also in the report, and that is something that we will be discussing at the Newport Safeguarding Board. So we will absolutely be taking that forward.
Thanks. Amy?
Thank you, Chair. I think just, I don't know if Chair, Cabinet members and elected members would be aware, but one of the barriers we have to Group 6 is, as a regional team, we are more than happy to come and deliver Group 6 and deliver in a manner that sort of suits needs. So Group 6 currently, it can be delivered as a full day, or it can be delivered as 3 2-hour sessions. You know, we can be very flexible in working around that. And I've also spoken to Caroline recently following a conversation with the deputy leader at a White Ribbon event on Friday around how we can not just meet the Group 6 training requirements under the statutory guidance, but also add on to that to cover points of, you know, signposting, where to go, etc., as you've just mentioned, Councillor Marshall. But I wanted to note that in trying to scope then how best to support councillors, elected members in meeting their Group 6 requirements, I've uncovered that you'll obviously be more aware of this than me, that your induction or your training requirements are set by the WLGA, I think it is. And there is a conflict in the statutory guidance in that Welsh Government statutory guidance under the Act says that councillors and elected members should be attending and completing Group 6 training with a refresher every sort of 2 to 3 years. But there is nothing in the WLGA guidance that says that you should have to complete the VOWDSV training. So the two don't actually marry up. And I'm not quite sure. I've had to seek advice from Welsh Government as to what takes precedence, if any. So up until now, we've sort of been reliant on leaders completing Group 6 and attending, because we can't sort of, whereas we can say the statutory guidance says this, that and the other for the other groups, it says it for Group 6 for elected members and cabinet members, etc. But your WLGA guidance doesn't support that. So there is that disconnect there. But I would hope that, yeah, for Group 6 within Newport, we, you know, if we were to put something on, we could obviously get everybody there, because I've seen over the last couple of weeks myself the commitment from, you know, senior leaders, and especially from the leader and the deputy leader as well in meetings I've been in with them, that there is momentum to have this training. And I know obviously I prepared the briefing for the leader as well with the additional information. So I'm more than happy to be your point of contact, or even sort of come 2 days or sessions with you to be able to work through the information and provide the information, training sessions, whatever you need really. I would need to take further guidance from Democratic Services on how we balance that against the WLGA guidance.
Thanks, Amy. I got to be honest, personally, I wasn't aware of that discrepancy. I mean, speak off the top of my head, I would imagine that statutory guidance takes precedence, but that's just me off the top of my head. But Tanya's just indicated to me now that that is going to be taken on board and looked at. So hopefully that'll get sorted out in the very, very near future. Councillor Marshall?
Yeah, thank you, Chair. And the next point is just a point, just hopefully that, you know, within this, that those that are involved within this aren't having a burnout, because it is quite a, you know, a complex area, if you will, and hopefully that, you know, the staff are fully supported, as I'm sure that they are, but just a reassurance to the committee would be nice, you know, just to confirm that we are aware of what's going on the ground, and that they, you know, people are fully supported. And then that's the same as just about the kind of challenges that may be faced within other departments, such as like the housing side of things there. So if someone does have to leave, what are we like as a local authority in terms of working with each other in other departments, just to make sure that, you know, we are working collectively to make sure that we know what each other's doing, and that basically that there's a somewhat smooth, you know, kind of procedure and processes in order for someone, once they you know have an intervention, or they're coming in because they've had to leave a situation quite urgently, and about how they get out and how they're supported through the other side. Again, that brings through partners, and about that training awareness within the teams to make sure that that's incorporated. So there is, I suppose, two comments, and my last question for this evening is just basically it involves technology and about the ever-evolving threats online, which is different because obviously the complexities, because it's not like the physical person. How do we know who that person is, and they're able to be anonymous in the background? So it just about how is the strategy prepared, or is preparing to tackle the rise in tech facilitated abuse and exploitation, especially as we're seeing young people involved in that, about taking pictures. I know, you know, there's been various cases about people in authority, you know, basically, you know, being caught out with this, and just how are we evolving within, you know, we understand the context of abuse and things like that there when it's a bit more physical sometimes, or the financial side of things there, but how are we evolving in this new tech world, because people don't switch off from the world, as I speak, you know, that it's in their hands, on the phone, that it's in their computers. So just to hear if there's any comments that you would like to raise as part of that, please. Thank you.
I'll bring Tanya in for that one a second, and I'll come to you, Amy. Thanks.
Yeah, thanks. I just think, you know, I think it's a very complicated area. I think it doesn't specifically, you know, relate to this specific agenda, you know, as in this is domestic violence, but it is an offshoot of safeguarding as a whole. It will certainly be something that our regional safeguarding board will be looking at. I know the schools are doing a lot of work in this space as well. It's a multifaceted area that is ever growing. I do share your concerns, Councillor Marshall, and I think the only assurance I can give you is that we're doing our best to keep up with the way this issue seems to be growing arms and legs.
Sorry, Chair, can I also ask Tanya, just as an officer, maybe to also link that in with schools, not to forget school governors, because I think sometimes we do forget that. I think they have a very important part to play within this regard, as well as link governors, but overall to understand, you know, I speak for, I think, all of us where we are school governors in terms of the councillors on here, that we should know our rights, but also every other elected governor should understand what they're expected to do, and even have knowledge, because there's some that I'm sure that have no knowledge of what this act is or what it entails. So if that can be also relayed, that would be fantastic. Thank you.
That is a really good point, actually. I mean, we're all governors of two schools, not minimum one, but most of us have got two schools. So really good point.
Just very briefly to come in, because I'm conscious that moving on. But just to say that the board, this new board, is actively going to be looking at member training in relation to Voucher SB, making sure that all members have had that level 1 basic training, and also the same in relation to safeguarding training as well. We're linking it with Leanne Roberts in relation to ensuring that that not Leanne, because that's members generally, but we are linking in with our Chief Officer for Education.
Well, thanks, Tanya. Amy, did you want to come in at that point?
Yeah, just to sort of I'd support what Tanya has outlined, that it is ever evolving and it's really difficult to stay on top of as well, particularly in relation to AI. It's really confusing and really difficult. But in relation to that rise in technology assisted abuse, or abuse through what we term as Internet of Things, IoT, there's Gwent police are sort of tracking then, and their analysts often collate information on how that rise in technology assisted abuse is happening. I think we're always going to be in a position where once we understand the picture, we go to respond to it, but then it's evolved again, maybe 2-3 times over by the time we respond to it. But what we are continuing to do through our comms work is to make sure that children and young people are fully aware of how to stay safe on the internet, not just in relation to sort of grooming or, you know, sexual exploitation, but in relation to stalking and harassment and catfishing and things as well. So we are trying as best we can to get the word out there, get the campaigns up and running, and particularly we work really closely with the education safeguarding leads as well, and we share sort of new trends or new information so they can go and speak to designated safeguarding professionals in schools about it. But I do fear that we will forever be on the back foot because technology is sort of evolving so quickly. But as with everything in our strategy and everything else, we will aspire to do what we can.
Thank you. And just a comment on that, if you allow, Chair, it's just mainly the fact of, you know, that seems centered around professionals and the children themselves, but hopefully there's integration with parents, because parents wouldn't understand half those terms either. You know, children are having phones from the age of 8, 9, 10 years old now these days. And I know, you know, various other places are looking at laws. I think the UK has suggested maybe they're hinting at, you know, what Australia are doing potentially. So there's different things there, but just to incorporate parents within that as well, because I'm sure that as I said, they just physically wouldn't know what is behind technology today because they've never had it themselves. So, you know, the fact that they think that because the child is in the home and safe in their eyes, that might not necessarily be the actual situation and the case.
Yeah, it is the ongoing problem with online and artificial intelligence, isn't it? Councillor Jewett.
I just want to just call to mind the influencers on social media, some of whom are misogynist. And it's very, very difficult to combat that. And the White Ribbon campaign, which tries to get men and boys to become allies of women, is one small way. But then these things have to start in a small way and grow and grow. This is a big problem. It's a big problem for society. But we need to start working small beginnings, each one of us, and particularly men and boys who are the perpetrators in most instances of violence against women.
Yeah, as you said, these influencers, they have millions of followers in some cases, don't they? And they're propaganda, for want of a better word. It needs to be tackled this week. But if we, rather than them becoming normalised, it's up to us, isn't it?
Free speech can't be, you can say just what you want. It has to be moderated free speech.
Cousins. Yeah. Councillor Marshall, was that the last few questions?
Yes, it was, Chair. Thank you.
Thanks very much. Can't see any other hands up at the moment. Has anybody else got any other points or questions they'd like to raise? Councillor Hussain. You're on mute at the moment.
Yep, sorry about that. Yeah, just a few questions. Anyone can answer. So with regards to the training, the Valdasvi training framework, I mean, how effective do you think the local authority has been in implementing the training framework? I know I've seen the feedback, but is there anything that you have recognised yourself to support whatever views you might have? And if you could let us know what those might be.
Wants to pick that one up. Amy,
I don't mind.
Oh, Tanya?
Yeah, I just think I think we could always do more. I think ultimately we aspire to achieve 100% of the staff having, the level 1 for certain, and also that those staff identified that needing levels beyond that we could do more. I think there is a bit of a challenge of staff leaving and starting, so I suppose we may not ever achieve 100%, but definitely that is what we would be aspiring to.
Mm-hmm.
Thanks. Amy, did you want to add anything in?
Yeah.
Yeah, if that's okay, Chair. I just wanted to say that I think, as Tanya mentioned, there's always the need to do more, but I think the challenge around Newport being effective in implementing the training is often down to sort of systems as well, and how broken up the groups are across the, so because the groups are set up in the way they are, this doesn't always support Newport in implementing it effectively, because as we've mentioned earlier, it sort of requires additional resources which are not always readily available. So I just want to put for the record that Newport are doing everything they can to effectively implement the framework. It's just some of the way that the implementation of that framework is prescribed means that it cannot be done because the resources are not there to match it.
Thanks, Amy. Councillor Hussain?
Yeah, just a couple more questions. Is there any ways that you believe, like, as we as elected members, how can we enhance our role and to promote the awareness of Valdasvi in our community outreach work, in within council operations?
Tanya?
Yeah, so I think as a starting point, as I've already mentioned, there will be a push for all councillors to undertake the basic level of training, and that email. In fact, I sent an email today to heads, which would include the head of democratic services, around ensuring that members are undertake this training, and we'll be monitoring that in January, monitoring the initial uptake in January. And as far as taking it out into your communities, I think the point was made earlier in the meeting about making sure that the number around the live fear free is available within the community settings that you visit. That when you're having conversations with your members of the public, where you feel this might be an issue, or where it's not an issue, just generally raising awareness with it within your communities, because you are in the heart of the communities. You speak to people on a daily basis, and you're an absolute key tool in spreading the word around this.
Thanks for that. Sorry, just realised, Caroline, you got your hand up.
Yeah, no, that's fine. Thank you, Chair. Just to add, Amy mentioned earlier that they have merchandise, so we can have conversations with Amy going forward now around what merchandise she does have, make sure that we're getting that distributed in appropriate places and increase the risk to raise that awareness. And certainly if there's any of that merchandise that is suitable for yourselves as elected members to have, whether it's a digital leaflet or something that you can download, or a pile of leaflets. You know, I'm not sure what merchandise Amy has, but if there is merchandise there, we need to be using it and we need to be utilising it and making sure everybody's got aspects of that, so that that keeps them on their agenda. They know what they need to talk about to their residents and local citizens. You know, our job is to support members in those community conversations you're having. So just about making sure we use that merchandise effectively, so it's not just sitting there not getting used.
Yeah, no, absolutely. I agree with that, because I mean, we all have ward meetings as councillors. We have ward meeting with the police. We have ward meetings with housing and other organisations, and it would be good if we can have, you know, members can have some of the materials that you're talking about and the resources, so that we can actually distribute them as well to make people aware of it. So if we've got something in hand, it would actually be, you know, beneficial for us and obviously the communities too. Just one final question. Looking ahead, you know, with future trends and social changes, how do you anticipate any impacts how councils implement their responsibilities regarding VODAS? The obvious one, obviously, with the funding, but is there any things we should be doing to prepare for this, for these changes?
Sorry, Chair, I just want to understand, make sure I'm understanding the question properly, Councillor Hussain. So there's changes in relation to the pressure that we're going to be having on local authority budgets. Is that what you're referring to?
No, actually, for the councils, like local authorities are implementing the framework, the training framework now. I mean, going forward, will you be carrying on this framework, the training, or is it just like a one-off thing, or is it something that you're going to be carrying on doing? And with like exactly, you know, with budgets and things, are you preparing for anything like that for the future?
Okay, so Amy will correct me if I'm wrong, but this is the national training framework which was being rolled out and agreed by a Welsh government. So it's not a one-off thing. It'll be an ongoing rollout of this national training framework for the foreseeable. So it's not job and done. It's something that will continue to evolve over a number of years and continue to be delivered to new workforces as they come into not only local authorities, but also partner agencies as well. I think go back to what we discussed earlier in the meeting about managing the implementation and pressures. We've heard, haven't we, that the funding envelope attached to this agenda isn't sufficient to meet the need. And I think what we will need to continue to do and will do is to continue to lobby Welsh Government around the need for an increased funding in this area.
Okay, thank you. Yeah.
Sorry, Councillor Hussain, just going back to what you said about the training, if I've understood things correctly from earlier, you're saying that it should be a continuous sort of 2 to 3 year cycle anyway of the pressures.
Yes. Correct.
So it's not just a one-off, it is an ongoing process. Yeah. Sorry, Councillor Hussain, back to you.
No, that's fine, Chair. That's, you know, just that's what I was asking anyway. So yeah, that's fine. It's not a one-off thing. It's something that's going to be continuing. Yeah, that's good to know. Thank you.
Thanks very much. Councillor Druid.
Just say, as well as formal training, there's informal training, and just recently, as part of the White Ribbon programme of events, there was on the staff network, there was an informal training event.
Seminar, wasn't it?
Yeah, absolutely, which was really good to take part in.
Unfortunately, I was working that day, but I did see it advertised. Has anybody else got any other questions or comments they'd like to raise? Deafening silence. I mean, we've had a whole load of information and stats. I've got to just speak in person now, but one of the things that really shocked me that you mentioned earlier, Amy, I know it's dangerous to stereotype, but when I think of domestic abuse, I've always in my head thought of younger, macho, emotionally immature males beating up their girlfriends and this sort of thing, which I know does go on. But when you said that the average age of a domestic homicide was 61, I found that absolutely shocking. I mean, I knew it went across the age range, but for that to be the average, I found that absolutely shocking. So that's really stuck in my head. Makes me realise how many, the breadth of agencies that we need to work with to tackle this problem. But can I just thank then Caroline, Rhiannon, Amy, and Tanya for coming today. Can I ask you to stay just for 5 more minutes, because we do need to just collate all the comments and make sure that everyone's happy with what's been said. I want to thank the Cabinet members as well for attending and contributions. Thank you very much. So I'm just going to hand over to Neil for a second, just to summarise everything that's been discussed.
Thanks very much. Yeah, so we'll go and so we've recommended working with the communications team to increase visibility of the VF3 number. And recommend looking at improving the search function on the council website so we can find the relevant information more easy. Committee noted the importance of lobbying the Welsh Government to increase the funding, resources and visibility of the services. Committee emphasised the importance of prioritising building up the trainer cohort within the council and finding ways to release staff to carry out the role. We've requested more information on the intersectionality aspects of training in future reports. Recommending all member training on VAWDS to be implemented. So we take that to democratic services, and also on division of merchandise leaflets to be sent out to members. Apart from that, was there anything else the committee would like to recommend or no?
I mean, personally, I think that covers everything that I can think of. But Councillor Marshall?
Yeah, thank you, Chair. Just a quick one for me. I think within that, just whether or not through the Cabinet members and the WLGA, if basically through their leadership, because I know Cabinet members obviously have their meetings, just to implore them to also negotiate that way as well, because I think the stronger the force coming from all sections, but also to make other local authorities aware, if they're not already aware, that that's an issue, so they can further lobby the Welsh Government to hopefully get a better resolve. Thank you.
Was that to do with, sorry, Councillor Marshall, I just want to check, was that to do with the discrepancy between the statutory guidance, statutory training and what's in WLGA guidance?
It was to do with the lobbying Welsh Government over resources, etc., for the training wise.
Right.
Lobbying resources.
Yeah.
Okay, thanks, Councillor.
That's brilliant. Thanks very much. Well, in that case, thanks again to everyone for attending and giving your time. We really appreciate it. Thank you.
Thank you.
Thank you.
I'm just going to ask the councillors to hang on for a minute. We haven't finished our meeting yet. You stay where you are.
Thanks, everyone.
Excellent. Cheers. Thanks. Right, we just got items 4 and 5 then. Scrutiny advisory reports first of all.
Chair, can I come in just very quickly on that?
Yeah, of course. Yeah.
I don't know if my colleagues agree, but can we feed back initially maybe how because having worked in this sector, how impressive for me anyway, certainly Amy Thomas was in her honesty and command of the role and her passion really. I think it was,
I would absolutely echo that, 100%. Yeah.
Yeah, from
Yeah,
she fielded a lot of challenging questions, and she fielded them predominantly herself. And I just think it's really reassuring when an officer in a lead role can do that. And it's just it was reassuring is the word, I guess. So it just might be, before we do anything more comprehensive, just to feedback to her line managers, just a well done really.
Yeah, no, I absolutely endorse that. Agree with you. I was thinking that I didn't think of the feedback, to be honest, but I was thinking as she was talking, she really knows her stuff.
Yeah, I didn't want to put her out
very
in
well
front of the managers, but I think it'd be nice to do it anyway, wouldn't it? I think.
Exactly. Yeah, I thought the same thing. She was, yeah, she had good knowledge of everything. I mean,
Yeah,
she didn't
absolutely.
hesitate. She was, she was on the ball on everything. I gotta admit as well.
Yeah, great.
Yeah. Thanks for bringing that up, Jason. It's a really good point. Yeah.
Cheers, Chair. Thanks.
Sorry, Neil. Back over to you.
So we in the actions monitoring table, all actions are completed. We're still working with Caroline about the seminar, any intervention with children, adults with housing. Our next thing now would be in February. It would be a contest against terrorism. So that would be part 2 report. And then on the 19th of March, we've got the EAS value for money report. This is a review report which goes through to committee. And then the outcomes monitoring, everything is all up to date. So we send these comments and recommendations to officers, add these to the table, and as soon as we get updates from them, we can email the committee.
Fantastic. Thanks, Neil. Something's just occurred to me, something I never do. I always thank the people who come to be scrutinised. I never actually thank the officers, but thank you. And last thing on the agenda is minutes of the previous meeting. So are we all happy? Thank you, Stephen. And I'll second it. Am I allowed to as chair? I think I am. Anybody else want a second?
I'll second you.
Thanks, Jason. You click, that'll do. Right, that's brilliant, thanks. Just to say as well, the contest one in February, I know it's going to be a little while, but that one's not going to be recorded for probably obvious reasons. So that won't be made available online. But it's to do with counter-terrorism, so that's obviously quite a sensitive subject. But in the meantime, thank you all for your time, and I'm not going to say Merry Christmas because I'm going to see you all before then, but thank you. Good night all.
Thanks, Neil, Joseph. Cheers. Thanks, John.
Thanks, Chair. Thank you.